Hi YouTube, this is Ben from Train Yourself Fit, and this video is one of 3 on how to fix your knee pain. Specifically, I'm going to be talking about things that I've commented on in blog posts, one last week and one that I'm publishing this week. So this video is to help you visualize what I'm going on about there, and I'll link that blog post in the comments below. So first things first, when it comes to knee pain, what you're looking at is going to be shortening of muscles that pull on the tendons that cross your knee joint, such from your quadriceps, your hamstrings, or from your calf muscles. And essentially what you can get in those muscles are things called myofascial trigger points. All that basically means is knots in the muscles, actually within the muscle tissue, or within the muscle fascia, which are essentially sheaths that sit over the top of the muscle fibres. So you think of muscle fibres such as in your quadricep, all run in one direction. To relax and be at a full comfortable length, what you're looking at is no knots at all in the muscle. But if you were to get knots within the muscle, that straight away is going to be shortening the fibres, which is going to pull too much on the tendons in the knee, causing pain, things like a buckling knee, or even a knee that are locked and won't fully straighten, or which can't bend once it is straightened. So to get rid of those problems, what you're going to be doing is exploring for trigger points within the muscles. The most common source of the trigger points is going to be in the within the quadriceps, which is on the front of the thigh, simply because the quadriceps tendon, visualize this as the quadriceps coming from your hip, attaches down here into the front of the shin, just below the knee. And the kneecap actually sits within that tendon, so any shortening of the muscles via trigger points within any of the heads of the quadriceps is actually going to stop the muscle from relaxing fully, which is pulling all the time basically on those tendons, causing pain. So the way to look for the trigger points, if you take both hands like this, literally grasp around your thigh, and with your thumbs press firmly, starting just above the knee, pushing in with an even level of effort all the way around the muscle, pushing all through the muscle, working your way back like this. And what you're looking for is anywhere that feels particularly tender. The usual spot for that, when I say tender, is going to be like particularly painful. Once you've found those spots, basically take your hands, for example, like this, supporting, massage in one direction, basically for a stroke of about 1 centimetre to 2 centimetres, pushing in the same direction all the time, whether downwards like this or rolling the trigger point backwards in the direction of the heart. And what you're looking to do when you're massaging those trigger points, if you look at the back of my hand, see how the skin's heaping in front of my fingers as I press down, release the tension to reset back to the original point. So that essentially you're pushing the skin over the top of the trigger point, which in turn is going to be pushing on the fascia of the muscle and actually into the muscle fibres themselves, since you're applying pressure. What you want to look to do is think of a pain scale from 1 to 10. You don't want to go above a 7 on that pain scale, otherwise you're actually going to be causing more harm than good. And once you've done your 10 to 12 massage strokes, leave it at that for the time being, and maybe go back to it 3 to 5 times a day. That way your body is going to be able to relax and heal itself. Other places you'll be looking for trigger points too, be in the back of the thigh and your hamstrings. Those can be massaged a little differently, either with a foam roller on the floor if you have one. If not, take something like a hard ball, in this case a hockey ball, and placing that on top of the chair, like so. What you want to look to do is to sit on top with your hamstring, placing the weight down, and again roll anywhere, investigating to see if there's anything painful there. Once you find a spot, literally just do the short stroke, 1 to 2 centimetres, pushing down from the top to add pressure if needs be. And that again will get rid of the trigger points in your hamstrings. Alternatively, might get trigger points in your calf, the gastrocnemius muscle, and the soleus, which is the flat muscle underneath. To find those, sit like so, so you've got your leg at 90 degrees. Bring the opposite leg over, starting near the bottom of the calf, place that on top of the knee with pressure. then all you're going to be doing, working from one side of the muscle right across, exploring the whole muscle. Apply pressure, stroking down the knee. And again, you want to apply firm pressure, looking for any particularly tender spots. And again, when you've found those, pause there, and literally, if needs be, you can pull on the leg to place more pressure, or just use muscular tension to pull the leg into the knee. And literally just do those 1 to 2 centimeter massage strokes again on the particular spot. Ease off the tension, reset, and again do the stroke each time 10 to 12 times. That's how you get rid of your myofascial trigger points. Those are what are going to be the main cause of any knee problems initially, so always search those out before stretching. But in the next video I'm going to go over stretches to address things like muscle shortnesses which come about from lifestyle problems as well. First things first though, always investigate trigger points, because if you've got any kind of knee problem, I can guarantee you're going to have those, particularly in the quadriceps. Okay, hope this video helps. Thank you for watching, and be sure to check out my next video.